Good evening, ladies and gentlemen. We thank you for joining us this evening. We thank you for your patience. We thank you also for continuing to adhere to all the protocols and the regulations that have been set by the Ministry of Health, Wellness and New Health Investment. This evening, we bring to you a statement by the Honorable Minister for Health, Wellness and New Health Investment, Dr. Irving McIntyre.
Pleasant good evening to all listening at home and abroad. Fellow Dominicans, I'm here with you this evening for yet another press briefing as relates to COVID-19. Before I begin, I will let you know what's our present status, which is the total confirmed COVID-19 cases remain at 16, the total active cases remain at 2, the total recovered cases 14, total COVID-related deaths, 0. Number of persons tested, 417. The number of negative results, 401. Number of contacts identified, 152. The number of contacts cleared, 152. The number of contacts under investigation, 0. And the number of persons in the quarantine facility in Portsmouth remains at 15. Out of the 2 active cases, both of them will be retested this weekend with PCR testing. And as the protocol goes, if we get 2 negative within 24 hours, these patients can be discharged. It is now 28 days since we've had our last positive case. This is largely due to the closure of our borders, effective contact tracing and isolation, efficient primary health care team, the ability to have in-country testing, compliance by you, the public, with the public health and social measures implemented, and the team effort involving all stakeholders. In view of the above-mentioned facts, and taking into consideration the following, that is 0 level of transmission presently, our healthcare capacity to handle resurgence of cases, our ability to reintroduce or tighten the public health and social measures, particularly in vulnerable settings, schools, hospitals, churches, supermarkets, fresh market areas, and these are the vulnerable settings. And if we have the ability to reintroduce, this makes us feel much safer as regards to how we adjust our restrictive measures. The community engagement through education and health promotion is an integral part of this defense against COVID-19. We are making further recommendations as regards to adjusting our public health and social measures. These include allowing reopening of appliances and electronic shops, reopening of clothing and textile shops. The public is also given permission to access the beaches and rivers under specific conditions. That is, between 8 a.m. and 5 p.m., Mondays to Saturday, as part of stress management. There must not be any barbecues on the beaches or the rivers, and there must be no consumption of alcohol on the beaches as well. There must not be loud music, picnics, or parties on the beaches, and groups of not more than 10 persons will be allowed. Practicing physical distancing as much as possible. But I must warn you that there will be the police manning and monitoring these beaches. So anyone found not complying to these measures, appropriate action will be taken. Business places are permitted to reopen and function and can do so on Saturdays from 8 a.m. to 1 p.m. that businesses which are allowed to operate must put in place measures to ensure that their staff and customers adhere to the Ministries of Health preventive measures and guidelines as follows: maintaining physical distancing 6 feet with clear markings where applicable, mandatory wearing of mask upon entering and whilst in the facility, mandatory hand sanitizing on entry and exit of the facility, and giving of appointments where applicable. Failure to implement these necessary measures will result in the temporary closure of the specific business places. The ministry advises that following business remain closed, and these restrictions will be further reviewed on Monday the 11th, 2020. Bars, nightclubs and game shops, hair salons and barber shops, sulfur spas, schools, churches, gyms, manicure and pedicure shops as well. The primary healthcare services continue with appointments and home visits to be done on a weekly basis. The secondary care services at the Dominica China Friendship Hospital remains as is. That is, no visiting and no elective surgeries. Oncology and cardiology clinics by appointment only. Temperature screening at the entry gate of the hospital will also continue. Complete lockdown to remain in effect on Sundays, as well as curfew from 6 p.m. to 6 a.m., Mondays to Saturdays. I must emphasize that adjusting the restrictive measures is not a carte blanche. It does not mean business as usual. As a matter of fact, we are in a new normal state. We must continue to practice hand washing, respiratory etiquette as regards to how we sneeze and how we cough in the public, proper wearing and removal of masks, and we must always wash our hands before wearing our mask as well, sanitizing and disinfecting our homes, businesses, and workplaces. Before I end, on behalf of the government and the people of Dominica, I would like to extend my deepest sympathy and condolences to the Cuban Medical Brigade in Dominica and the Cuban people as well. Last evening, there was an unfortunate incident where one of our Cuban Medical Brigade suddenly collapsed. He's a 42-year-old male. He came to Dominica on March 29th as part of our Cuban COVID Medical Brigade. He completed 2 weeks, that's 14 days of quarantine in Portsmouth, after which he was assigned to the COVID isolation unit at the Princess Margaret Hospital, where he worked from the 16th to the 20th of April. After completing his work schedule from the 16th to the 20th, he again did another 2 weeks quarantine, which is the normal protocol. 2 weeks quarantine after you've been to a COVID facility, and that he completed. He was due to begin work again yesterday when he suddenly collapsed. He was supposed to have started work at the Accident and Emergency Department, so it was a very sad day for the Cuban Brigade as well as for Dominica. And for this, we extend our deepest condolences and sympathy to the people of the Republic of Cuba. I must extend our deepest thanks to all the local businesses who continue to assist with donations. And our new to list is Tranquility Beach Resort, a collection by Hilton Hotel. They've brought in 3 ventilators, which we have on island. And for this, we are very grateful and we appreciate it very much. Also, our gratitude to all the frontline workers who have brought us where we are today. But it's work in progress. We shall keep assessing the situation, and as time goes along, we shall adjust the measures. But I must stress that we must remain vigilant and we must adhere to all the measures of the Ministry of Health. We cannot forget the simple things that have brought us where we are today. That is hand washing, respiratory etiquette, physical distancing, and sanitizing our homes and our workplace and business places. And I must say as well, we must not assume that this virus is only in the urban areas or in the city areas. It can also be in the rural areas. So those of us in the rural areas, our villages, we must adhere to all the measures being put in place. Wearing of our mask, our physical distancing, because there's no discrimination between rural and urban as regards to COVID-19. Please stay vigilant. Please adhere to all the measures. We have come so far. We have done so good. Let us continue to do it just the way we have been doing it. Do not let down our guard. Let us stay focused. We can do it. We have done it before. We must stay focused. I thank you.